Dan Williams, Survive Outdoors. If you're new to the channel, we do wilderness medicine videos on injuries, how to prevent injuries, illnesses, Lyme disease, spider bites, snake bites, hypothermia, sunburns, how to treat yourself in the outdoors before getting back. And today we're going to focus on prevention and some treatment. I have some questions, and I promised you guys I would do this video about 2 months ago, and I let it slip by. So we're going to target today how to tape a knee before hiking or trail running. My next door neighbor does a lot of trail running. This is for you, Brian. So all muscles are attached to bones by tendons, and I'm sure you've heard of things like epicondylitis, for example. You have tennis elbow and you have golfer's elbow. Depends on the side, and that is usually an overuse injury. And anytime that you're going to have a tendonitis, it's usually from overuse. It can be from 1 or 2 incidents of trauma, or even 1 incident, but most of the time it's overuse. For example, this muscle is the brachioradialis, and that origin of that muscle is right there on that condyle right there. And one of the treatments that we use is taping or a strap that goes on there. And with knees, that large thigh muscle is actually one of the top 4 strongest muscles in your body. The 4 strongest muscles are your masseter muscle, clenching, your butt, your gluteus, and your rectus femoris, that's the thigh muscle, and the 4th one just escaped me. Wow, I lost it. So the rectus femoris, that muscle's your thigh. It encompasses your kneecap, your patella, and then inserts down on what we call the tibial tuberosity. So if you look at this model here, up here is the big thick muscle of the thigh. It comes down, encompasses the kneecap, and then this muscle, this tendon here, inserts right down here. And then there's something called patellar tendonitis. And that's when this tendon gets really inflamed, and when you walk, it hurts like hell. When that happens, this tendon is usually, you get this patellar tendonitis from overuse, running, jumping. In fact, it's actually called jumper's tendonitis. So you get these guys rock climbing, they'll jump from a rock to rock. And that's a lot of trauma sustained on this area right here, especially trail running. You're going to have injuries to this tendon. So we're going to be talking about taping of the knee and how to prevent some of that right now. So before we tape the knee, this is U Daily K-tape, and I like this. It comes in black, blue, beige, pink, and a lot of physical therapists use this tape. It really works well. You can see it's used for a lot of different areas. I've used this on lower back. I've used this, I haven't used a lot of this on wrists, but I definitely have used this on the shoulder, and we're going to obviously focus on the knee. So this is basically any kind of sports tape. And one of the things I like about this tape is it comes in these long strips, and they come apart pretty easy right there. You're really not going to need anything longer than that, and if you do, you can actually overlap this. And so I'll use this, and I actually encompass some duct tape with this. So here we go. So for patellar tendonitis on my knee here, just below the kneecap this is the patellar tendon right here. It inserts here, and they make straps. You can get them at Walmart. They're Velcro. You can tighten them down, and what those do is it literally takes the stress and tension off the insertion. It gives a chance for this to heal. This K-tape you can use also. It's a little wide, in my opinion, for the treatment of a patellar tendonitis. So you can definitely take a knife. You can cut this in half, longitudinally down here. Very, very easy to do. And when you tape the knee, even for patellar tendonitis, I usually have the knee flexed, not at 90, but about 45. So we're going to take this tape and take that strip off. And I am going to hold this very tight right across just below the patella. I'm going to straighten my leg out a little bit. So between here and here is where you want it. I'm holding that pretty tight, and it stretches really well, which is great. And I'm going to put that pretty doggone tight, and I'm coming around the back. And that is going to take some pressure off of this area here. And I'm here to tell you the ones that you can purchase are better than just taping. If you have an active tendonitis, then I would really, really recommend those. You can have one in your pack. They're really handy if you're prone to getting this injury. So that is one of the easiest taping methods. And the strap we use for talon's elbow goes right about here also. And the Velcro are nice because you can then tighten those as you need. All right, so prior to going out on a hike or prior to trail running, what is the best way to tape this so you relieve some of the tension off these muscles and don't create an injury? So you can do one of two things when you tape this. I like anchor points. Now, yes, you can shave your leg because the duct tape will take your hair off, and sometimes it can be very irritating in the skin. I've even seen situations where it has taken skin off. So you may want to use this after you get done taping and use the anchor point. I have had no problem putting this directly on my skin, but word of caution, I'm going to do this one on my skin, and the other one below I'm going to do on top of the K-tape and give you both examples. So I put this one up here as an anchor point. Now, if you saw my video, and I should put that at the end, on closing a laceration with duct tape, that's what that scar is from. Last year I actually incised my leg to show you how to tape that, and it healed quite well. I caught some hell about that, actually. Some guy was like, oh my gosh, I can't believe you did that. I'm 64, I'm not doing leg commercials. So then you can take your K-tape here, and the first two pieces, you're going to take this and you're going to run this, and that's what this is for. It'll adhere because you're going to sweat. So I usually run it the superior to the top. I run it down along the sides, and about here I start coming in below the insertion of where that tendon is. So boom, that's the first piece right there. Then I'm taking my second piece, and I'm going to do the exact same thing. Wow, they make you don't. This is tough to get this off, I have to admit. And so the second then piece, I'm going to start from the top again, just be lateral to the outside of my kneecap. I'm going to put that right on my anchor point with that duct tape. I'm smoothing it, I got a little bit of tension, and I come around and I cross that down below. Like that. And then I'll take this and I'll run this right here. Remember I said sometimes you can do it on top, and I'll run my duct tape on top. I've also done this for, I don't know, 8 years ago, 9 years ago, I treated a semi-pro basketball team in Sauk County, Illinois, and we did this for their knees, and it helped quite a bit. So that is one of the ways you can brace this, and this will help in terms of taking less pressure off of the muscles that are being used, and works really well. If you want to, you can take a second piece of K-tape or duct tape, whatever you prefer, and run that on top tight, and you're set. Now here's the deal with this. If you're running for 3 or 4 miles, you don't have to use this duct tape. It's not an issue. But if you're out there and you're going to be on an all-day hike, you're going to sweat. This is going to peel off a lot of times. And so, you know, it's really important to anchor this down. And with this type of taping, with the sports tape, a lot of physical therapists, for example, they won't use the duct tape at all, but they're individuals that are going to be out there, their patients or clients are going to be working for 4 hours on the court, 2 hours on the court, and it's not an all-day run in 80-degree weather or bicycling. So in closing, some of the main points when you tape your knee: don't have your knee straight, don't have it at 90, have it at about 40-45 degrees when you tape your knee. You can use anchor points like you saw what I did. You don't have to use anchor points. You can just use the sports tape, the K-tape, and do that. If you're out running and you're starting to get pain and you have a tendonitis, something of that nature, and you've had a history of that, go ahead and tape that tendon down tight so you're taking some of the tension off that insertion area. So that's the basics of, it's really fairly simple. It pays off, swear, trust me, it does pay off. Try it sometimes. Tape your knee before the hike, before your trail run. All right, keep your eyes on the horizon. Keep your face to the wind. Take care, guys. See you next time.